All right. Welcome everyone this evening. This is the Rural Mental Health Town Hall. My name is Perkins. Joining me is Shauna Reitmeier. Tonight we're gonna be on for an hour. Shauna and I are going to be talking about a number of issues that kind of branch off of the or fall under the overall umbrella of rural mental health care. If you're watching live, by all means, send in questions. We've got somebody monitoring chat who, if we get some questions, we'll try to answer those as well. Otherwise, there's certainly there's plenty to cover in an hour. So, Shauna, do you want to start off by thank you for coming, by the way, and please start off by telling everybody who you are and what the Northwest Mental Health Center is.
But well, thanks, Reed, and for this opportunity. And you may need to keep me focused at certain times because I get very passionate about this topic. And
Good.
So I'm really excited to be able to talk about mental health. And so my name is Shauna Reitmeier, and I have the pleasure to serve as the Chief Executive Officer for the Northwestern Mental Health Center. We are physically located, our primary office is in Crookston. However, we serve 6 counties here in Northwest Minnesota. So we're in Kittson, Marshall, Polk, Norman, Red Lake, and Mahnomen, with a little bit of services happening in Pennington and in Roseau counties. We are a certified community behavioral health clinic, and we kind of call ourselves a one-stop shop. If you walk in our door and have an assessment, we have a wide range from birth to end of life of behavioral health care. We pretty much do all kinds of outpatient, community-based services, except for like inpatient hospitalization. We don't do detox, and we don't have a licensed residential program, but pretty much everything else we're able to do. We run a 24/7 mobile crisis team. We have psychiatry. We do homelessness services, and we also provide school-based services with therapists co-located within local school districts throughout the region. And so we really, because we're the only mental health agency in the 6 counties that we serve, that we pretty much try to be as wide and broad as we can to meet the needs of community members throughout the region.
Well, awesome, and thank you for joining me. To briefly introduce myself, I'm the DFL endorsed candidate for Senate District 1, which has a fair amount of overlap with the counties you just mentioned. Senate District 1 is Polk, Red Lake, Pennington, Marshall, Kittson, and Roseau. So a decent amount of overlap, but obviously, even though some of the direct area of service doesn't overlap, these issues affect not just
Definitely.
Northwest Minnesota, it affects all of rural Minnesota, and these are issues we are seeing across much of rural America right now. So I'm running for Senate District 1. I was born and raised here in Minnesota. My background, I have a bachelor's in biology and a master's in teaching. My wife is active duty Air Force. We've moved around a little bit, but now I'm back here in Minnesota, and I'm looking for ways to try to give back to a state that gave me so much. And part of my background as a science teacher, I've always tried to impart to my students the idea that you are never going to be an expert in every single subject, and that part of being a good scientist is being able to say, I don't know about something, let's go talk to somebody who knows more. That's not weakness, that's not bad behavior. Like you should be able to say that. We should be able to go, all right, this person knows this field. Let's bring them into this conversation and let's ask them for their expertise. And so I have a little bit of experience in the world of mental health care, and certainly I've done my fair share of reading on it. I'm lucky enough to have a campaign manager who has worked in rural mental health down in Iowa for years. But tonight I wanted to bring in Shauna Reitmeier to speak to these issues as somebody who is an expert in these fields and can speak more directly to your experiences on the ground. I had two experiences early on in this campaign that really brushed up against mental health care. Grand Forks, so just across, I live in East Grand Forks, so just across the river. The Grand Forks School District is piloting a K-12 mental health coordinator position. And I got to attend a speech from that coordinator, which was great, talking about how important it is that we be talking about these issues in the classroom, and that there are so many mental health tools we can provide to our students that can prevent some problems later on down the line. And then a couple different meetings with the Minnesota Farmers Union, who has been trying to bring this front and center. But let's start kind of with education. I know, Shauna, you have some strong feelings about giving those tools early and what that can mean to people.
Oh, you bet. I think that the earlier we can go upstream and address mental health issues, the better it's going to be in the long run of preventing what I think most people, when they think about mental health, are these serious, persistent mental illnesses. And I think it really comes with early childhood, from birth to 5-year-old, of how do parents attach? How do parents and moms that might have postpartum issues, that are struggling after giving birth, to attach with children? And this relationship of the child and the parent is so important, because that's going to give children that stability, and it's going to give them that grounding that they need to know that they are connected. Because we know that children actually do much better in meeting developmental goals and educational outcomes when they know that they have at least one adult figure that they have a relationship with. And for most children, that's their parents, right? And then you get children that go into schools, right? And they're now involved in interacting with their classmates, different dynamics that they've not had to figure out. Teaching that emotional regulation at that early age helps children just adapt and become as resilient as they can when they're faced with challenges throughout their developmental career. And that's why I'm so excited and love the school-linked mental health program that Minnesota has issued through legislation, through grants, that we have been able to embed mental health professionals or providers in school districts to do assessment, intervention, treatment, and education within the school districts to teach teachers, how do you set up your classroom to help support children so kids can be successful in that classroom.
One of the things that you mentioned that I really want to highlight, and I think it's going to come up, this analogy will likely come up again and again tonight, but you talked about how if we give these children tools early, and if we set them up for success, then that heads off many problems down the line. You mentioned catching a problem upstream, and mm-hmm. we all know in looking at something like our physical health, if we go and get a checkup and if we catch a cough early, then great, a little round of drugs and you can be back on your feet. But if you wait, if you put off that appointment, if suddenly you develop bronchitis or pneumonia, those treatments are substantially more expensive and substantially harder on both your body and the pocketbook. That the old expression of an ounce of prevention is worth a pound of cure. And we see that, we apply that all the time to the physical body, and remembering that same thing applies to mental health care, that if we can provide these students tools in order to better feel grounded, in order to better feel capable of dealing with the stresses of being a kid and a teenager, mm-hmm. that we can head off some of those problems down the line that you mentioned.
Oh, I think that's a great analogy of the cough turning into pneumonia is very similar in mental health. If you're dealing with stress that's not being resolved, that builds up, then, you're looking at inpatient hospitalization for mental health issues, which is so much more expensive than it would be for just going in for maybe 6 sessions of therapy with a provider, or learning some of those skills, and not only is it a cost factor of an inpatient level of care being much more expensive, it's also much more traumatic that then also exacerbates mental health issues
Sure.
for people. And so that's a traumatic situation that people go through. And so sometimes our own systems that we are trying to build to help support can perpetuate some ongoing mental health issues as well that's important to address.
Yeah. And I think this is certainly something that I found heavily in dealing with the Minnesota Farmers Union. Part of that acceptance, part of helping people see that these are tools we should be providing to students, and similarly that these are tools that adults should be seeking out as well, is that unfortunately currently mental health care carries a pretty heavy stigma with it. My wife is active duty Air Force, and certainly there, we are more aware, or at least has been talked about more broadly in the last decade or so about PTSD and mental health issues in the military, and I've seen firsthand the work that the military is trying to do to start destigmatizing seeking help for these sort of things. That it's not a that don't try to be macho and tough it out. Like, you have a community here to try to support you. We can help. And I really found, again, that the some of the farmers groups in the area were working very hard to tell everybody this, you're not alone. Everybody, like, people feel this way. Please come and get help because we can help and that help is available. But that stigma exists very strongly, and it's one of the reasons I was so glad that you were willing to do this event with me tonight, because even just highlighting it and talking about the fact that we need to be working on mental health care issues, bringing these conversations forward, I hope at least pushes us towards that goal of, if you have a cough, you go and see the doctor, of course. Like, if you have that available to you, you do it. And that similarly, we need to be seeking this out with mental health care, that stigma unfortunately exists.
Oh, it definitely does. I'm glad you brought up, the Farmers Union group and agriculture, because I'm a farm girl. I grew up south of Crookston. My dad farmed, third generation farming family. And I know it's really hard for many farmers and ag community members to seek care. And that's why I love, what Minnesota has done with the Department of Agriculture of actually committing resources specifically through their mental health, helpline. And I know Monica very well, who is our person up here in the northern part of Minnesota. But I also, want to highlight that while Monica's one person, there are resources of people that have this background and know this area, and getting that help and reaching out, I think, is so important. And with now the expansion of telemedicine, where people don't have to drive and worry about, is my pickup going to be seen outside of a building, and people are going to know that, okay, that's Shauna pulling up, in front of that building. What's she doing at that mental health office now? Well, do I wish that wasn't a worry for people? I wish we didn't have that stigma. I wish there wasn't discrimination against mental illness and people seeking help. The reality is it's there. And so, our farmers they deal with stressors that many other people are not experiencing in their day-to-day lives. That's very different. And so taking care of your mental well-being and these stressors are so important at the front end. And I know we're going to go into that telemedicine topic a little bit later. So just a little foreshadowing.
Yeah,
there.
But it is important to see that I mentioned this in a town hall that I was on a couple weeks ago as well, but I was reading an article about how the author was talking about back in the 60s that America seeing Sputnik caused us to really have this moment of, are we falling behind? What are we doing? And that caused us to sink a bunch of money into science education, a bunch of money into education across the board. And that really launched the space age of the 60s and 70s from this event of seeing Sputnik. And this author was saying, hey, if we can take this moment of COVID and we can use COVID to launch the health age in the same way Sputnik launched the space age, that we now have seen how important some things like telemedicine are for everybody. And it so happens that that has a strong overlap here in the rural areas. And I mentioned in the beginning, there are so many issues that fall under this umbrella. But I mean, Kittson County, a county that falls under both of our coverage areas, has the lowest broadband internet coverage rate of any county in all of Minnesota.
Right.
And I want to say, I think Pennington County is third least. One of the other counties in Senate District 1 is third least. I think it's Pennington. But in Kittson, it's 44% of residents in Kittson have access to broadband internet. So ensuring that we do things like expand that infrastructure is important to this discussion of telemedicine and this discussion of mental health care as a whole. And it's important to understand, especially from the angle of a legislator, that in order to put forward an effective mental health care platform, that it cannot just be, well, let's throw money at mental health care. That right. there are side issues impacting this, and that goes back a little bit to you mentioning, you don't want to be seen, if your truck is in front of this building, what might your neighbors think? And it is a holistic sort of approach towards changing these views. But I think progress is being made on that front.
Right. It's ripe for opportunity. So I've been using this phrase about using this as disruptive innovation with COVID-19 and the situation that we're in, right? How do we use the circumstances that we're in to use this disruption for innovation? And I think this is a real opportunity for Minnesota as we look at, potential legislation down the road and revamping some of those telemedicine issues and getting broadband, in this day and age, everybody just about has a smartphone, a device, right? Mm-hmm. That I can, on this device, see a provider. I could be a farmer in the tractor, mm-hmm. getting what I need and still being able to do my job, go up and down the field or pause at the end of the field for an hour session and not have to leave and drive an hour to get to a therapist, and so we keep talking about in mental health care, the access to providers is so hard because there's so few and far between psychiatrists getting mental health providers. And while we try really hard by embedding our providers within primary care clinics throughout the region, and we've got this great relationship with all of them, that's only a couple days a week. But well, what if I'm there on Tuesday and I can't be there Tuesday, but I could be there on Wednesday with you wherever I'm at. But if I can't connect and I don't have that ability, then, it's going to put people at a disadvantage from getting the services that they need. And when you talk about Kittson County and in that northern area, death by suicide is huge. Those communities have been in Roseau County, they have been just rocked by death by suicide, and are the population that's greatest impacted are middle-aged men. And so many of those middle-aged men are our farmers in our area, and so boy, if that person could have had that broadband, right, mm-hmm. could have used that smartphone device and been able to connect with the scarce providers that we have across our region, and I can't say, would that have prevented that? I don't know. But you know what? We strive for zero suicide. That's an initiative. That's a goal that we want. We want zero people dying by suicide, and having access to what they need. So, that just goes into so many different areas, that we could just go down the rabbit hole in many of those.
But you're right. Like and obviously you're right that access to mental health care is not going to be the cure all for death by suicide, particularly in our ag communities. When we look at when we look at, being a soybean farmer over the last decade, I mean, the price of soy is half of what it was in 2012. When we look at the feelings, one of the feelings that I've gotten as I've talked to farmers in this district is this sense that they are powerless, that there are so many things going on above them, whether that be the trade war or whether that be restrictions on how they can fix their tractors that exist now. There are so many things that make them feel like they're not in control. And so obviously attacking the death by suicide issue includes more than just mental health care. But if that person could sit in their tractor and be like, all right, I need to talk to somebody for an hour, and they had that opportunity, I think it would go a long way. And certainly I very strongly remember I believe it was the Polk, Red Lake, and Marshall counties Minnesota Farmers Union meeting, and they had a woman get up and talk about her own experience of suicide ideation, and that she was talking about how she went out to the barn one day, and she did her morning chores, and she turned back and she looked at the house, and she wasn't certain like why she should go back to the house, and it hit her very quickly, and that she was so taken aback by how quickly those thoughts kind of descended on her, and that fortunately that she went back to the house and talked to her husband, and then things improved, and obviously she's now helping other people on that route. But the neighbors being there for each other, because I think we have certainly, I think culturally in Northwest Minnesota, there's a certain stoicism. We feel we shouldn't be burdening others. But this is what we're there. We are neighbors for a reason, and we're neighbors to care for each other, and we're neighbors to be there to say, yeah, like what you're going through is similar to what I'm going through. We can go through this together. And breaking down those barriers. So it's not just that mental health care is absolutely includes access to providers, but it's also that sense of community and that feeling that you are able to publicly talk about these issues.
Oh, I'm so glad you raised that, Reed. So like if you remember, I talked about how, kids, one of the biggest factors of their developmental and educational milestones that they achieve is having that one adult that they've been able to connect to. Well, that's the same as adults. So we are hardwired as individuals to make connection. We need people around us. And when we start getting under stress, and when our mental health, we're not feeling as healthy, that's a sign. When I start isolating and pulling away from people that I normally would, then as neighbors or as friends or family, if you start finding that, Reed or Shauna or whoever is, I haven't seen her in a while. I haven't seen her in church, or she's not coming to these events, or normally I like what's going on and checking in, that's that sense of community, that, well, we might be pretty stoic, and we are, I think, farmers are the quintessential pull yourself up by the bootstrap kind of people, right?
Yeah.
But we also know we work together, as families in many instances. And so we still need to stay connected. We need to be with people. And that's a key sign, if mental wellness is starting to wane a little bit, and that with stress. And so that's where you as an individual, if you start thinking about, what am I doing? What are those behaviors? What are those actions that I'm doing that, maybe I need to think about? Is this stress? Maybe it is. And we don't realize it because we just think stress is stress and everybody has stress and we're all fine. But there does come a point when that stress level gets to be too much. And then we start kind of retreating from things that are normally the things that we normally do. And then for our family and friends and neighbors and community, that's also a sign of, when to kind of step in and just say, hey, let me bring over some dinner, or let me help you get that hay out this year, or let me help you, do you need some help? And people aren't going to ask for help very often. So that's when you just say, hey, I've got, my kid is able to come on over and help with this. And, I know you got a lot of stuff on your plate, so we're just going to do it. But that's what I think we can do, because that's so important to mental well-being, is that number one is the relational component and that social connectedness that we have with people around us.
Yeah. And it's important in terms of remembering that, I mentioned it can be so easy to feel powerless in the face of some of these problems, and remembering that all of us are capable of turning to our neighbor and saying, hey, like, how's it been? Like you said, I haven't seen you in church, or something like that.
Exactly.
So I've got a submitted question that I want to throw out to us. The question is, so thank you for people in the chat listening and submitting questions. Question is as follows. Tina Smith recently spoke on her own mental health issues as a candidate. How might Minnesota address barriers like that and others to running for and participating in the political process and running for office? And I think this gets to, like, the reason I wanted to finish that last topic before transitioning is that speaks to that idea of community. Because one of the things that has helped me, look, I don't think I'm going out on a limb here by saying that this is a politically uncertain time for a lot of people. And
Sure.
by reaching out and by being a part of the communities in this area, both the things like the farmers unions that I've been able to go to and be a part of those groups there, or meeting with other candidates who are running for office and sharing some of those, sharing like, hey, you're going through this, I just want you to know that I'm experiencing something similar, and that moment, that good politicking, at least as far as I'm concerned, is frequently finding that common ground and finding the areas where each one of us can help each other. That's kind of the goal. And so it has been helpful for me to be running for office because it's helped me find these communities. However, certainly the idea that mental health can be a barrier for candidates running for office, undoubtedly, I believe there is they might have retired, but I believe in 2018, there was a congressman elected to the U.S. House, and I don't even want to speculate what state, but they were diagnosed OCD and very strongly OCD, and not the kind of OCD that often pops up in media where, like, oh, well, they just have a really neat office. Like, no, this is somebody who was OCD, and it interfered with their normal functioning. And I know for a while they had to step back from their position, but that people, when I mentioned at the start, reaching out to people who knew more than me on a subject, and when we're trying to get mental health issues, when we're trying to get mental health legislation passed, including people who have mental health issues in those discussions is an absolute necessity. And so making certain that those people who have mental health issues can come to the table in some way, whether that's as a candidate for office or whether candidates for office very purposefully invite them to the table so their voices are heard, that is an absolute obligation of the system. And yeah, it can absolutely be a barrier in terms of running for office.
Oh, you bet. And so, boy, there's a lot in there, right?
Sorry, I talked for a while, so.
No, that's really good. But I think there's a couple things that I want to really highlight in this. And as we unpack that a little bit is, one, I just, mental health and mental well-being, have no political bounds, right? Yeah. It is non-discriminatory. It will impact anybody regardless of, race, ethnicity, cultural backgrounds, political, leanings or affiliations, involvement in, rural areas, urban areas, all of that. So it is, I think, so important that we realize the prevalence of mental health. And so 1 in 5 people are going to experience a mental health issue at some point in their life. So think about that. The next time that you're in an event or you're sitting around a table or you're with your friends and you start counting off 5 people, one of them is probably going to have a mental health issue. So, for Senator Smith to highlight her own mental health issues at points in her life, I think one just brings a level of knowledge and understanding and empathy to legislation or to topics that, boy, you know what, if I've not experienced this and now I have to go and vote on something or I need to, highlight certain legislation, how effective am I going to be if I don't have that? So why I'm so thankful that you are having this conversation of getting, getting that background knowledge and people that have that front line, boots on the ground experience is so important, because that's where policy, I think, always gets such a bad rub, right? Is when things are enacted and I'm like, do you have any idea what this is going to mean? Yeah. And she's doing that, and that's what, I think is so important for us. But mental health, is, anybody is going to be impacted by that, regardless of where they land. And so, and it's, I think one of the other pieces is that we have to be, people with mental illness that now qualify as a disability are supported under the ADA, the Americans with Disabilities Act. And, we have to be conscious. And this is where I think stigma was always the big word, and where now discrimination and a lot of our advocates are really talking about mental illness is discriminated against for people that have that are not being offered jobs, are not being, considered qualified or capable to do a job because of the mental illness. And that's just not the truth. I know many people with mental illnesses that, have, held down jobs and have been able to run, and whether this, congressperson that has OCD, I think I almost think we're better for it when we have people with so many diverse issues, right? And so I just have to make sure I raise that, and because I know that's not what you're talking about, but it is how important that sense of community, and we know how prevalent mental health issues are. It's just when I think 1 in 5 people, I mean that's a lot of people.
Well, and it mean when you talk about, like, of course people with mental illnesses can hold down jobs. We know 1 in 5 people have mental illnesses.
Right.
The unemployment rate is not 20%. Like, of course people with mental illnesses are holding down jobs. I found the name of the person that, as a science teacher, I am legally obligated to cite my sources.
You bet.
Pennsylvania State Rep Justin Simmons. And what I was thinking of was he had been reelected as a state rep, but was seeking federal office and stepped back from running for federal office because of his feelings with his OCD diagnosis and what he was able to overcome with that. So Pennsylvania State Rep Justin Simmons. So again, a lawmaker who has OCD to the point where it is absolutely interfering in his daily life.
You bet.
But as you said, we can all think of a time when we've seen a law and we've thought, did anybody who was writing that law ask the people who were going to be affected? And we can see that with ag. We can see that with we can see that with roads, where like there's a plan for a new intersection or something, and people in the town are like, did anybody who make that plan drive that intersection to know what this is actually going to do? The same thing goes for mental health. If either mental health care practitioners or people with mental health diagnoses are not brought to the table as major stakeholders in these policies,
Right.
And it's not even an issue a legislator can have the absolute best of intentions. Like, it doesn't even have to be a discrimination thing.
Right.
If you have not consulted, if you have not asked the people who are going to be affected by this, you're not going to be able to know. And then good policy is only going to happen by accident at that point, which is not the way we should be doing.
Right.
Which is not the way we should be doing policy. So to transition a little bit, Shauna, you and I were talking earlier. We talked here about catching issues before they become big problems in terms of age. But you had some comments about catching things upstream, even in adults that are minor incidents. And I was wondering if you could share some of those thoughts a little more broadly that you.
Well, you bet. So, I think when I think of mental health and mental well-being, I think of it along this continuum, right? So you have kind of those mild disruptors that happen in our life. And a lot of those kind of fall under this classification of adjustments that happen. So, getting a divorce, grief and loss, the death of a loved one, just being, some of our farmers that have now all of, this stress, so just like compounded stress, loss of a job, so these things that are, they're new, they're adjustments, and it kind of rocks our world, right? We don't really like, what do I do with this, and having this, overwhelming sense of emotion and not knowing how to, cope or have good coping skills might result in, instead of going and getting some mental health help by talking to a therapist or talking to a pastor, talking to your doctor, talking to your best friend, I always talk about who's my 3 a.m. friend. Do we all have a 3 a.m. person? If something rocks our world at 3 a.m, who's the person you're going to call? And do they know you're that person? That's the other part,
Sure.
And so, it's that end of the continuum is those things that just kind of disrupt us, that, we're adjusting to something new. If you catch those early enough, it can prevent in some instances, and in many instances, people from like having, substance use disorders, because sometimes people self-medicate and they drink and they, might take drugs instead of addressing the issue. I'm going to just numb out, start eating, start just, okay, the once in a while, binging on Netflix or whatever is good, but you're checking out, right? You're checking out from what's going on. And when we don't address those things, it can lead to more serious issues like depression. And then depression, can really become very debilitating for people. And then the more you start seeing functioning declining, I'm calling in sick to work more frequently. I'm avoiding cleaning my house. I'm not engaging with my friends or my peers, or my performance is suffering at work. It starts becoming even more debilitating. And, and then you start having even that further end is people with serious persistent mental illnesses like schizophrenia and bipolar disorder is that other end, and not necessarily saying addressing stress is going to prevent schizophrenia. They're kind of on a different spectrum in terms of illness, but major depression can become a serious persistent mental illness for people. And so let's catch it upstream. So when you have those life disruptors, that's the perfect time to say, in talking, just having that opportunity to talk to somebody about, I don't even know what to think about this. This is really hard. And I'm anxious. I'm finding my kids are distressed. I'm distressed. COVID, that's perfect example, right? All of a sudden, schools are being let out. I have to work from home and my kids are at home. That like threw everybody, for a tailspin of like, now I've got to figure out this new schedule, this new rhythm, who's on the computer at what times, and I've got to work and we've got to be quiet, that, just I think is a great example of one of those stressors that if not able to regulate and you don't have those abilities in your own home to cope with that change, could really lead into some other pretty significant issues with relationships with other mental health. So that's kind of when I think of that, that's how I connect those dots.
And again, it gets back to that, an ounce of prevention is worth a pound of cure. And there are so many things that we don't think of normally as, oftentimes if we think, the death of a close loved one. Okay, that's something that, even in sort of a stigmatized view of mental health care, you have somebody close to you die and everyone's going to be like, okay, well, go and talk to somebody. Yeah. That's something that all of us kind of view as that, but that there are absolutely other things. Again, talking about my experience as a military spouse, more and more in military circles, we're treating cross-country moves or cross-planet moves as the sort of thing where you do need to view that as more akin to a death than anything else in a lot of instances. Yeah. Obviously, some moves are great and everything goes well, or there are some military moves where you're moving to Alaska and the container that has all of your furniture falls into the North Pacific, which happened to my wife's last commander. And that's going to be more of a traumatic event. But just in general, losing that connected groundedness, that sense of community when you're moving to a new space, and that treating an event like that as something that should be looked at as we need to talk about it now, and therefore it's something small before it kind of balloons into something larger. And then the other thing that you mentioned there was you talked about how depression can spiral into some larger life events, or some larger mental illness sorts of things. And I want to emphasize the connection back to physical illness, that we can see physical manifestations of so many of these mental symptoms as well. And I know you were talking to me about how so often that mental health is kind of treated as separate from a lot of these either different insurance plans that might get through your job, and that these are it's kind of a luxury add-on in a lot of cases when this is all. Like, if you are ignoring your mental health, or if you're ignoring your physical health, or in the same way that if you were ignoring your spiritual health, or if you were ignoring your social health, there are a lot of aspects to people, and that I'm certain you have some experiences with how mental health care gets set aside from a lot of the overall healthcare legislation that exists.
You bet. Well, I like to just have us all look in the mirror, right, at some point, and see that our head is connected to our body, right? So we can't think about it different. Like, my head is here. It's a part, it's all part of who I am. And we are so physiologically, mental well-being can impact physical health. And our physical health can impact our mental health. And so it's so important that we look at that. And that's why I think that it's one of those things that we need to start thinking about, I think, more systemically, of how are we funding the healthcare system to integrate and be inclusive of mental health. So right now, how physical health gets paid is very different than mental health. Well, there's some services, under the Affordable Care Act, whether people are for it or not, has brought some parity. People have to have access to mental health and substance abuse services that they would not have had access to without that. But the difference is that, Medicaid for people that qualify, or for people with commercial insurance. Let's flip that narrative a little bit. So if you have people with commercial insurance, if I say had a hip replaced and I needed to go in for rehabilitation services, not just physical therapy or occupational therapy, but I needed that support to go into a rehab facility to get all of those therapies to get me ready to move back home. Those are available for many people under their insurance plans. However, for mental health, there are evidence-based treatments and interventions that are called rehabilitation services that teach the skills that brings and allows a provider to come into people's homes in order to get those services. And those are not covered in many instances in many commercial plans. And yet those services can prevent people from going back into the hospital and having another psychiatric issue. They're able to prevent other issues such as potential incarceration and people going into jail because their psychosis is such that they do something and then they end up in jail. And so I think these are things that we need to start thinking about. Like, why do we get to cover the rehab services for a physical health issue, but we don't have the same access to those rehabilitation services for mental health?
Yep.
And so I think those are some things that, I think we need to think about, because actually it's costing our system more and it's costing our taxpayers more because we're paying for these really high level of care services that could potentially be addressed in somebody's home or in a different lower level of care.
Yep. And so especially, so we've got another question, and this will probably be the last question then before we kind of start wrapping up. Okay. And it's a good one, and I'll talk at least for a second on it to give you time to think of an answer. It's a good question. What is the top legislative change and or top cultural change that could help improve mental health care right now? And so if I was thinking on this as you were answering that last bit of the question, and there were part of what you said there at the end, when you talked about preventing incarceration, because if there's one thing, I recently wrote up a bit on our website talking on the Perkins for MN1 website. Every Monday I have some policy that I write up. And I talked about mental health first responders. And I cited the state of Oregon, which their 911 emergency services now, rather than just sending your call to police, fire, or an ambulance, now has an additional funded by the state program of mental health first responders. And that, if we're looking at a homelessness incident, if we're looking at drugs, something that's clearly an addiction incident, if we're looking at other things that are very clearly stemming from mental health, we want somebody there who's responding to that who has mental health crisis intervention training, which very often our police are just not equipped with that training, and that sending our police out into that sort of situation is setting up our police to fail, because they haven't been trained to deal with that sort of a thing. And so we then can take a situation that might have either escalated to violence or become an issue where that person might have been incarcerated, if instead we are sending somebody who is trained on mental health resources that we're A, dealing with the situation more safely because we're sending somebody out who's trained to deal with that situation. But B, we're also saving the taxpayer a lot of money because we're not then putting this person into our prison system. Instead, we're providing them the resources to continue to be a strong member of society, which is what everybody wants. Like, nobody wants to send so many of these mental health issues into our prison system, but other states have found ways, and again, I highlighted Oregon in this piece I wrote up, but other states have found ways to start shifting that so many of the problems that mental health care that we see that stem from mental health care, that we've shifted so many of those burdens to the police when we haven't equipped our police to deal with those issues. and that
You
shifting
bet.
some of that burden back to mental health care professionals so that we can deal with it correctly, we can keep it out of the prison system, it's safer for whoever is in trouble at that moment. That mental health first responder model would certainly be a legislative change that I would love to, if I have my magic wand where I can suddenly make a policy appear,
Sure.
that would be a strong one for me.
Right. Well, and I think what's exciting, and I'll answer the legislative and the culture piece too, but I'll maybe highlight just to provide a little more education of how things are structured here in Northwest Minnesota, is that under current Minnesota state law, it does allow 911 to call mobile crisis responders if that happens. And so we just have it. It allows it to happen, but we need to now talk about, okay, what does that look like with our, 911 dispatches throughout, Northwest Minnesota? And what does that look like? Because again, Northwestern Mental Health Center runs a 24/7 mobile crisis response team. And I can tell you the relationships and the partnerships we have with our law enforcement officers between the city police departments and the sheriff's departments is just tight and spot on. And we've had a really great opportunity to provide crisis intervention training. So they have that, but there's turnover, and it's only being offered, once in a while. And there's always that ability where we don't want law enforcement officers to now have to become the mental health professionals, right? And so I think there's a great foundation. I think there's great opportunity for that to just expand and to grow. And so I love that response. And how do we make it even more robust in Northwest Minnesota? And we're working on some of those things, which is really exciting, to mirror states like Oregon that you referenced. I know in Texas, there's some places in Colorado have some really good models, and there's some pockets in Minnesota that are replicating that. And so I'm glad to see that that's something that you're really interested in, and when I think of what is the number one legislative thing, wow, that's a big piece, because there's so many that I think are so important. But I think the one that is the most important to me is, I mentioned earlier that Northwestern Mental Health Center is what's called a certified community behavioral health clinic. Now, we're running under a federal demonstration right now. We were fortunate enough to be one of 6 original clinics across the state of Minnesota to demonstrate this model. But what is so important is that regardless of a person's ability to pay, this full array of services have to be made available to someone. And so this gets at parity. This gets at, if I don't have that covered and I walk in the door and I want it and I need it, we have to provide it regardless if they have an ability to pay for that, and so we work with people, and that I see CCBHCs really need to be strategically placed throughout the state of Minnesota to have that be, because what it does is it sets a common definition. Every clinic has to do the same thing, where right now, if you talk to one mental health center, you've talked to one mental health center and what they do and how they provide services. There isn't consistency. So if I move to another part of the state, I can't guarantee I'm going to get this full array of services. And so embedding and making CCBHCs sustainable and have coverage throughout the entire state of Minnesota, that makes every person that lives in the state access to these evidence-based core services that are so important. And then culturally, the thing that stands out to me is we've just got to start talking about mental wellness as part of our narrative. We just need to make it, we talk about good physical health, and we talk about diet and exercise. We also have to talk about, the connection of the mind and the body. They're together. They're one from an early age, within businesses, with employees, within families, of just, being mindful and just practicing some very simple daily skills, gratitude, just talking about what am I grateful for today? just, I mean, we do that frequently in our household, around the dinner table. Well, what's the one thing that you're grateful for today? It's just, it changes, it flips that switch from what's always bad and what don't I have control over, that there is actually something good in our lives. And the more we start talking about that, I think the more that puts all of us on this path of wellness. So,
yep. Yeah, and that is, and as you mentioned, there's a lot of legislative changes we need to talk about. Ensuring that people have access to these regardless of their ability to pay, making certain that we understand that healthcare is a right, and we can look at various plans across the country. Here in Minnesota, we have the Minnesota Health Plan that ensures that you should not be cut off from these services for any reason. You are a human being, and you deserve the dignity of care.
Very much so.
And that unfortunately can also cross into a cultural conversation of stopping that stigma of feeling that, well, this person, because they might not have a job, then all right, well, then they're depressed. Big deal. Like, no, by solving these issues of care for everybody, it is better for everybody. I mean, I have certainly quoted Paul Wellstone plenty in this campaign, but I mean, we all do better when we all do better.
We all do better.
Yep.
You bet. You bet.
Well, do you want to? Our hour's almost up. Do you kind of want to give a short little wrap up, and then I'll say goodnight, everybody. Any final thoughts and comments? We've had a good hour here.
Yeah, I know. And we probably could go on for another hour with a lot more topics. I think that, if there's just kind of one thing that I can close on is that we all have mental health. We all have this, I think, innate ability to create resilience within ourselves, and that there are resources and you don't have to go at it alone. And so the more we can think about how am I being well, how am I treating myself, getting those supports and those resources for you as an individual, one, you're going to be stronger for yourself, because you go on an airplane, they always say, if, during those opening spiels, put on your own oxygen mask first before you start helping the person next to you. We're in an environment where it's really easy to give, and we deplete ourselves and our cup gets empty, but we can't help and we can't be part of a solution. We can't think about things if our cup isn't full. So put our own oxygen mask on, and that means practicing self-care. Be good to yourself. Go get the help when you need it. Start it as early as you can, because then, you're going to be greater for your community, for your family, for your employer, and everywhere that you intersect. And mental health is health.
Yep. But mental health is health. Yeah, that's I particularly like you're saying, look in the mirror. Your head is attached to you.
Here we are.
It is. We need to start including this, whether that's in K through 12 when we have our health classes, that we start making certain that mental health is included in that, whether that's any number of the other things that we've talked about tonight. But that idea of we have to include a look at mental health if we're going to be healthy as a whole. And thank you. So thank you so much, Shauna. I appreciate you being here tonight. I appreciate the work you're doing with the Northwest Mental Health Care Center.
Thank you.
And that these are conversations that I hope us talking tonight has helped other people see that these are conversations that need to be had. And again, I hope the very act of having this conversation helps us in that process of destigmatizing these issues.
Hope so too.
I hope, as this campaign season moves along, I hope we can maybe have another one of these, or at the very least, if I happen to be in St. Paul this time next year, I will happily have another one from the Capitol. These are conversations that need to be had. And as you talked about, we need to have people who are the boots on the ground part of the conversation with crafting this legislation. That the stakeholders for these issues need to be consulted when crafting these policies. So thank you again.
You're welcome.
We're gonna have other town halls on some other issues coming up in 2 weeks on August 23rd. We're gonna have an ag issues focused town hall, and I have no doubt one of the things that will come up in that town hall is mental health. We know we're gonna have on a member of the Northern Plains Sustainable Ag community, and we've invited the Minnesota Farmers Union on as well. There are a couple of the groups we've reached out to, but that's in 2 weeks. We want to keep having these sort of, hey, this is a person who is a stakeholder in this issue. Let's hear from them. And so, Shauna, thank you so much for representing mental health care and the mental health care provider community so thoroughly tonight. I really appreciate your time. Thank you to everybody who tuned in tonight or who might be watching later on. Thank you to the people who submitted questions. By all means, if you have additional questions to send to either Shauna or myself, I'm going to make certain that both of our contact information, if you feel you need to get in touch with the Northwest Mental Health Care Services, I'm going to make certain that contact information is linked in this video, along with that policy that I mentioned to the mental health first responders will be linked below as well. But thank you everybody for joining us tonight. Thank you, Shauna. Everybody, stay safe, wear your mask, wash your hands. You're not alone. And if there's one message to take away from tonight, this community to help does exist. It helps here in Northwest Minnesota. And we all do better when we all do better.